Okay, time to move on to the pathology of the facial nerve, facial palsy. So, what can happen once the facial nerve is damaged? Okay, remember the facial nerve. Before we talk about this in detail, let's just talk about the control of the facial nerve first of all. Okay, so imagine this is these are the lobes of the brain, and this is the facial nerve nucleus over here. One facial nerve nucleus, second facial nerve nucleus. Okay, and this is the face of the guy, and eyes, nose, mouth. Okay, so for understanding sake, we have divided the face into two halves. The upper half, actually the upper part and the lower part. This is not exactly this is not exactly in half of the face. Okay, so an upper part and the lower part. So this is the upper part of the face and this is the lower part. This dividing line is from the angle of the mouth. So the upper part of the face is actually controlled by the upper half of the facial nerve nucleus, like this. Okay, on the ipsilateral side. You divide the face like this. So this nucleus is actually controlling the face over here. This nucleus controls the face over here. Okay, now what can happen? How is this nucleus controlled? Okay, the upper half of the facial nerve nucleus receives input from both the cerebral hemispheres, like this. Okay, while the lower half only receives an input from the opposite cerebral hemisphere. Okay, and the upper half of the face is actually supplied by this part and the lower half is supplied by this. Okay, agreed. So what can happen if there is an let's say a lower motor neuron lesion and the facial nerve gets lesioned over here? What's gonna happen? You will lose facial expression from the whole of the face over here. Okay, ipsilaterally the whole face is gonna get affected over here. Okay, and what's gonna happen if there is an upper motor neuron lesion? If there is a upper motor neuron lesion, and for example, let's just say if you have a stroke or a cerebral vascular accident over here in the brain somewhere, what's gonna happen? Remember, the upper nucleus is not gonna get compromised. Okay, this nucleus is not gonna get compromised because if you have a stroke, let's say over here, you infarct out this cerebral hemisphere, you will lose input from this cerebral hemisphere towards the upper nucleus, but this hemisphere is still working and supplying this. So the upper nucleus is not going to get compromised. What is going to get compromised is the lower the lower part of the nucleus on the opposite side, because remember this hemisphere was also supplying the lower part of the facial nerve nucleus over here. Okay, so this nucleus is gonna get compromised because this is only receiving its supply from the opposite end of the cerebral hemisphere. So what's gonna happen? You will lose facial expression from this area only, the lower half of the face on the opposite side. Okay, clear? Okay, by the way, what is this called? Facial nerve palsy, lower motor neuron lesion. Okay, LMN lesion is also known as LMN lesion L. Okay, LMNL basically means lower motor neuron lesion. What is this also known as? Bell's palsy. Bell's palsy. How does Bell's palsy occur? The most common cause of Bell's palsy is viral infections. Why? Because remember, the facial nerve exits the skull to something called a stylomastoid foramen. Okay, this is the skull from and this is the teeth, so facial nerve exits the skull from something called a stylomastoid foramen over here. And it traverses the facial canal somewhere like this inside the skull, traverses stylomastoid foramen, and then supplies the muscles of facial expression like this. So this is actually a very tensed out area of the skull. Okay, the stylomastoid foramen is a very tight, compact. The facial canal is actually pretty congested. So each time there is a viral infection or a cold, for instance, the facial nerve swells up. And since it's a restrictive space, the facial nerve cannot afford to swell up like that, so it gets compressed and gets compromised, resulting in Bell's palsy, a lower motor neuron lesion. Okay. By the way, how do you treat Bell's palsy if this happens? You give steroids and resolves on its own. It's a self-limiting infection. Okay, the another cause of Bell's palsy is basically a surgery, because remember the facial nerve, once it's going like this, once it's supplying the muscle the facial expression, it passes through the parotid gland, and a tumor of the parotid gland can actually compromise the facial nerve. Or if some overzealous surgeon or an inexperienced surgeon actually tries to resect this parotid gland, and he can end up compromising this facial nerve. So it can result from surgeries, uh, which is basically called iatrogenic facial nerve palsy, or which is basically a surgical mishap, or for example, some tumors of the parotid gland can actually cause it as well. So this is a facial nerve palsy. By the way, what can happen? What are the additional features of Bell's palsy? Okay, remember the facial nerve also supplies lacrimal glands. So you will have an ipsilateral dry eye. Okay, ipsilateral dry eye, known as a Sika syndrome. Also known as keratoconjunctivitis Sika. Okay, a very $10 word for this. This is basic. And also, yeah, one more thing. It also causes hyperacusis. Why? Because of loss of function of the stapedius muscle. Remember, the stapedius muscle dampens the voices or dampens sound which is transmitted. So loss of this function will result in undampened or poorly dampened sounds, and basically some very loud sounds get transmitted to the hearing system, and you'll get hyperacusis. Okay. So this was the basic function of the facial nerve. This was the pathological implication of the facial nerve, also known as the facial palsy. Okay.